We're here with Dr. Vijay Iyer, Director of Cardiology for Kaleida Health, and we're going to discuss some questions regarding COVID virus and exposure.
The COVID-19 crisis across the world has demonstrated a substantial decrease in admissions for heart failure, for heart attacks, and also for strokes. It is unclear if this reduction is primarily because of patients' reluctance to come in, or are there other factors at play. But the reality is that in the hospital systems and in our offices, we are seeing fewer patients than normal with heart conditions. I believe this may be because of patients being worried or scared to come into offices or hospitals because of fear of contracting the coronavirus infection. It is extremely important for people who have cardiovascular conditions to continue their care, because otherwise they could have significant adverse events. The reality is that all doctors' offices have taken extreme steps to make sure that their patients are safe. That includes screening of all patients that come into an office or into the hospital to make sure that they're not febrile, that they do not have a fever. We are trying our best to separate those patients who have the coronavirus from those who are not sick with the coronavirus in hospital settings and in office settings. This means making sure that they are seen in different parts of the hospital, that those patients who are not infected with the coronavirus are coming in for a visit or a procedure are kept extremely safe with a mask, and the personnel who are dealing with them are also taking enhanced measures to make sure that they're not transmitting the virus. The reality at this point is that if you have symptoms that are concerning, whether it be chest pain or shortness of breath, it is most appropriate to get in touch with your healthcare provider. That could be your primary care physician or your cardiologist to discuss it. Almost all offices are now able to do telehealth visits. That means you can either have a conversation over the phone or a video conference. If the provider deems your condition to be significant enough that you need to be seen either in an office or in the emergency room or in the hospital, then you have the appropriate advice at that time. Anybody who has a predisposing condition, that includes cardiovascular conditions like hypertension, heart failure, previous heart surgery, or a heart transplant, are at higher risk of developing a severe form of the COVID-19 infection if they get infected. It is important for those individuals to take additional measures to make sure that they're well protected, whether it be with social distancing or with the use of masks. They need to make certain that if they do develop symptoms, they report it quickly to their primary care physicians or cardiologists. But at the same time, they should not ignore any cardiovascular symptoms with the intent of social distancing alone. Any patient who needs cardiac care is able to have either a telephone interview with a provider, cardiologist, or an advanced practice provider. They can have a video link wherein we can actually see certain parts of the physical examination that we would normally do in the office. And if necessary, they can also come into the office in a completely safe environment with appropriate screening so that they remain safe during their visit into the office. They need to have either a computer or a smartphone that will allow them to have a video link. However, for a telephone link, all they need is a telephone and they can have a conversation with their provider. At this point in time, for any patients who are within our practice or any of the other cardiac practices, the cardiovascular offices are open. Patients can schedule appointments either by telephone or for a video appointment by calling the Great Lakes Cardiovascular number. In addition, if they are sick and they need immediate attention, they should not delay and they should contact their providers in the usual fashion that they would.